Hello, everyone. Let's proceed to discussion of the feeble or deficient pulses, specifically the intermittent pulse, which is otherwise known as regularly intermittent, consistently irregular, regularly interrupted. So the keyword is regular, and or Dai Mai. So far we have discussed four deficient pulses: deficient, ready, faint, intermittent. Should you want to review, we have a YouTube channel, Acupuncture Matters. You might want to you just type the the pulse and you can listen to the lecture again. That's why we're recording this. Let's talk about the intermittent pulse. This is loss of beats. So as you can see from the figure, it's very the stopping or the losing of beats is very regular, very consistent. So what does this indicate? Zhang Qi failure and weakness. So this can also mean wind patterns, pain patterns, seven emotions, weakness, no, due to this, fright, knocks and falls. Failure and weakness of the Zhang Qi, deficiency and damage of Qi and blood, the pulse moving force powerlessly can all prevent the vessel Qi from being smooth and rhythmical. Okay, this can also be caused by excessive pathogens that block and stagnate the vessels. So there is constant Qi stagnation. Unlike the knotted pulse, if you remember the knotted pulse, the intermittent or regularly interrupted pulse is regular in terms of which beats it skips. After it has skipped a bit, it will feel like the pulse waits momentarily before it starts beating again. This is because the Qi is so weak. So it is unable to keep the blood in motion. Of course, very weak Qi will not maintain the flow of blood, no? And the body must gain strength before it can move the blood again. So that means there's too much weakness already. It may be necessary to feel the pulse for a long time before it skips a bit. That is why it is very important when you do pulse diagnosis, you have to wait for like 2 to 3 minutes, no? So you have to really, really concentrate, okay? So perhaps as many as 50 beats to be able to really, so this is very common in patients who are so weak. The intermittent pulse arises in deficiency conditions of the heart. So usually when a patient has heart issues, this is the pulse that you will often encounter. So the key word here is regularly intermittent, no? Okay. So let's go to the indications. So we have both X for the excess syndrome and the deficiency syndrome. So when this is due to an excess syndrome, it's consistently irregular and rapid. Okay, this can be caused by wind, pain, or emotional shock. In deficiency syndrome, again, it is consistently irregular, and of course, the pulse is forceless. That's why it's deficiency. So obviously, the etiology would be Qi and or blood deficiency, Zhang Fu organ Qi deficiency. So in biomedicine, um, there will be arrhythmia caused by MI. So start looking for, sorry, if you have a patient who has this kind of pulse, you have to really, really refer to a cardio. Your cardiologist will love you for it. Okay. And if you happen to be very, uh, like, if you're if you really refer a lot of patients to this cardio, they will probably refer patients to you in return, no? So coronary heart disease, so anyone with heart issues here, hypertensive heart disease. So it's so easy to tell. They have too many maintenance medications. Pulmonary heart disease, cardiac. So it's all about, okay, especially if the patient really, really would have the frequent ECG or 2D echoes, no? So if it is an excess syndrome, that means there will be pain, emotional shock, or pathogenic factors. And this will cause Qi stagnation and leading to intermittent pulse because the qi is so weak, so it's so difficult, or it takes a lot of time for the body to recover. So for the deficiency syndrome, the declining Zangfu organ, qi, and blood cannot form a successive flow in vessels, so the pulse is forceless and the beat is regularly missed. In cases of congenital, so some of these cases are congenital. This could prove to be the normal pulse for some individuals. So if the patient was born with it, so you don't need to worry, okay? This pulse can also be found during the second and third month of pregnancy, at which time it is also considered normal. So it's normal to see this on patients who have congenital heart issues and also second and third trimester. I'm sorry, first trimester of pregnancy, the second and third month of pregnancy. Okay? Yeah, it is considered normal. So this is a pulse which loses a beat and then pauses a little longer before starting again at regular intervals. To arrive at the Tsun position, the blood must flow through the lung 5 and through the Quan position. This means that it must flow from interior to exterior. It takes a lot of patience. Okay, so if you have a patient who has heart issues, this may be your chance to be able to really experience this. During the pause between beats, the blood seems to retract, ebbing up to the C point, but when it returns, there can be a double beat. So this is described as the lost beat being recovered. If there is not a double beat when the pulse returns, the lost beat has not been recovered. If one pulse beat is missed at regular intervals and then is recovered, the pulse is intermittent. So this is caused by qi that was damaged or deficient, okay, qi and blood deficiency or deficiency of yan yang. Yan is yuan's, this is the yan source point of the yang channels, no? If the intermittent pulse appears in a chronic disease, it is necessary to distinguish where the deficiency is to give the correct treatment. If the intermittent pulse is suddenly felt in a normal person, careful diagnosis is necessary to avoid incorrect treatment. So hasty, knotted, and intermittent pulse, they all miss beats. So you should not confuse the three. A rapid pulse, so hasty pulse is rapid pulse with missed beats. A leisurely pulse, uh, it is a knotted pulse and it misses a beat. Knotted, parang rope, no? The only difference between these two pulses is that one is rapid and the other one is leisurely, taking its time. They both stop at irregular intervals. So again, the key word is regular. The intermittent pulse, which cannot recover its lost beat, stops at regular intervals and it pauses for a little longer than one beat. Usually with a hasty or knotted pulse, the disease is milder, while with an intermittent pulse, the disease is more severe. So try to look for patients who have severe heart issues. The intermittent pulse is usually felt when there is failure and weakness of the Zhang Qi with deficiency of the Yan Yang. No? This is the Yan source of the Yang, the yang channels. It can appear when deficiency and damage of the lower yang qi causes abdominal pain, when weakness and deficiency, actually when you have abdominal pain, that is already a red flag. No? Try checking the pulse. You might be lucky to be able to experience the intermittent pulse. So that could be a heart issue. When weakness and deficiency of the spleen and stomach causes diarrhea, or when weakness of the central yang qi causes vomiting and diarrhea. If the intermittent pulse is felt occasionally after 3 months of pregnancy, that means there is deficiency of yang qi. Okay? Now let's go to assessment. Who would like to volunteer? Mom.
Yes, Doc.
Let. You only have 10 questions. Okay. What is the pulse relationship with qi and blood?
Uh, The pulse arises mainly from the flow of qi and blood in the vessels.
So basically what we're trying to do here when you check the pulses, we would like to see the situation of the qi and blood, diba? What is the role of the qi in pulse diagnosis? Like,
Uh, it's it is associated with the yang and governs movement.
yes, yang and movement. Blood role,
Associated with yin and provides the substance that fills the vessels.
okay. Qi insufficient and fails to move the blood. What will happen to the pulse? If the qi is insufficient,
So the
what
pulse
type of
will
blood?
be
Yeah.
forceless or choppy.
Okay. So qi insufficiency or failure to move blood, you will have forceless or choppy pulse because blood flow is not smooth. Okay, the blood is deficient. So you have blood deficiency. So of course, if you have deficient blood, it will fail to move or fill the vessels, no? What will happen to the pulse?
It's it's thin or hollow.
Yeah, thin or hollow. The substance of the pulse is
The blood,
power of the pulse,
the qi,
governs blood and vessels. What Zhang?
the heart,
There's the 100 vessels.
lungs.
Yeah. Yan source.
Hindi sure.
Okay. Transforms and transports. I know, very basic. Controls blood.
Spleen, stomach.
Yes. Thank you so much,
Thank you,
everyone,
Doc.
for joining.